People who are looking into my services often ask me what type of approaches I use, and that is a very valid question. So, in response to that question, I'm an eclectic therapist, so that means that I don't follow one approach 100%. I actually draw from several approaches. So there are three approaches that I am trained in and that I find to be really useful for people who are working through dynamics related to religion and leaving religion and spiritual abuse and religious trauma. So I will overview those really briefly right now. So first, I use an approach called family systems therapy. So in this approach, I'm really interested in the family that you grew up in. What were the rules of your family? What expectations were put on you? And how did you fit into your family and play the role of the expectation of your family? So I'm interested in anything related to common threads throughout your family, mental health, enmeshment, themes that you can see through your family. So that's a really interesting way to go back and look at the way that you were raised and where you fall within your family system. The second one that I really enjoy using is called narrative therapy. So in narrative therapy, we put ourselves as a character in the center of our stories. So previously in our life, we've likely played a character that we didn't actually know that we were playing. So as a result, we've played out certain themes and roles that actually helped us to survive and to fit into our context. So in narrative therapy, we become aware of that narrative and of that story, and we become actually autonomous participators in our story. So we can look to the past and say, I want to keep these narratives because they served me then and they serve me now. But there are other narratives in my past that, although I see how they served me back then, they don't serve me anymore. And in my narrative going forward, I actually want to write that narrative in a different way and play out my character in a way that I'm doing it on purpose according to my own choices and the rules that I make for myself. So there's a whole bunch of dynamics of narrative therapy, but it's all around your story and the role that you play. My third approach is called acceptance and commitment therapy. So acceptance and commitment therapy is all about learning to sit with the uncomfortable realities of living life and being human, but doing that with purpose and commitment because you know that you're living according to your values. So it's not trying to take away pain or discomfort, but it's teaching you skills to manage as you move in a direction that is according to the values that you set in your life. So all of my approaches to therapy are very client-centered, and I take the approach that you know yourself better than I do. And so I'm not here to give you advice or to tell you what you should do in your life, but I am also here as a support and as someone who maybe has some tools that would be useful to you and maybe some ways of asking questions that can make you go deeper into your own reality and your own story.